Are you seeing my screen?
Hi, Tracy. No, we see you.
You're muted, Tracy.
Yeah, I don't think I can do it. It's okay. The kids are just so much cuter than me, though. That's the problem.
Okay, good afternoon, everybody. I think we're going to get started with our afternoon workshop here, number 4 workshop. It's titled Bringing Wellness and Nutrition to Children of New York. My name is Andy Gilpin. I'm the Executive Director for Captain Community Human Services. And for us, wellness for children and food insecurity issues are just a major part of what we do here. And I have the pleasure of moderating this panel with some great guests here. So I'm just going to run down through them to introduce you, and we'll get started after that. So I'd love to introduce Christine Bozlak, the Associate Professor for Health Policy, Management, and Behavior from the University of Albany School of Public Health. Hello, welcome.
Thank you.
And I'd love to introduce Tracy Killar, Founder and Director of the South End Children's Cafe.
Hi, everyone. Thank you.
Yeah. And last but not least, Misha Marvel from Hunger Solutions of New York. Good afternoon, Misha. Wonderful. So what we'll do is we'll start our presentations and talk about this wonderful issue. And I'm so happy that everybody was able to join us, or those of you who are joining us. And we're going to start off in order. It'll be Christine, Misha, then Tracy. So when you're ready, Christine, please go ahead.
Excellent. Thank you. And I think my slides are going to be brought up here in just a moment. Great. So welcome, everyone. My name is Christine Bozlak. I'm an associate professor in the Department of Health Policy, Management, and Behavior. And I also co-direct our maternal and child health program at the University of Albany School of Public Health. I want to thank the food pantries for the Capital District for this opportunity today, and also to their wonderful staff. So Alex, next slide, please. So let's start with the wellness definition. So wellness is defined in a variety of ways. And we're going to use the definition from the CDC, and I'll let you read it there, which says that a minimum of well-being includes the presence of positive emotions and moods, the absence of negative emotions, satisfaction with life, fulfillment, and positive functioning. And although I think a lot of times we talk about wellness for adults, but we don't spend enough time talking about wellness for children. And when we think about wellness and all the different ways we should be thinking about it, we should look at all these different aspects: physical well-being, economic well-being, social well-being, all these other things. And I know that Tracy in a few moments will be talking about her wonderful work at the South End Children's Cafe and all the great work she does around wellness there. So next slide, please. So interestingly, my entire PhD dissertation was about wellness and thinking about how it's defined. So I was really thrilled to be invited to present. Even though my dissertation was 10 years ago, what I actually did was I gave cameras to kids and sent them out to the community outside of Chicago and said, please photograph wellness for me. What does it mean to you? What are barriers to wellness? What are the facilitators? And this is what they came back with. These were the themes that they created. And as you can see, food and nutrition was part of it, and physical activity was part of it. But there's so much more. They talked about the need for safety and intellectual opportunities and spirituality and really wonderful relationships with people, but also other people in their community that made them feel at risk. And so I think that when we talk about nutrition and wellness, we have to keep models like this in mind and remember that nutrition exists within this holistic definition, right? And certainly the kids in my study, the wonderful research participants taught me that so many years ago, and it continues to be relevant to my work today. So next slide, please. So I wanted to provide a little bit of a framework. I'm coming from a public health discipline, and my whole presentation is really to help set the stage for our additional conversations about how we're implementing initiatives or the initiatives to promote wellness and nutrition for children. In public health, we use this wonderful model called the social ecological model. And not to get too caught up in academic kind of wording right now, it's just a good reminder that we have to think about the individual and focus on the individual, but also think about the context in which individuals live, right? Think about the kids and the settings in which they live. And this is work that's been done for decades, ever since Dr. Bronfenbrenner worked on this too, thinking about the environmental settings in which our kids are living. It's not just the home environment, but it's the school environment and the community environment and the policies that are impacting them. So we use this model to really shape not only our thinking about the impact of nutrition on kids and if they don't have access to healthy foods, but also policy solutions and other solutions. Next slide, please. And also, I mentioned that I co-direct our maternal and child health program, which is my area of expertise, and we use this wonderful perspective called the life course perspective. And interestingly, it started as a theory saying that, we think that people are impacted throughout the course of their lives. So what happens to them as when they are a child will impact them as adults. And so much research has been done to validate this. Then unfortunately, we do know that if a child is facing food insecurity, and say in this period of COVID-19, where we're seeing food insecurity in our families, unfortunately, they're not just going to be impacted now. It could have long-term health impacts for them throughout their life course. And really what we're seeing too is it could have generational impacts. So, whatever experiences, whatever negative health outcomes they have as a result of food insecurity now could impact them in the future and then future generations. Next slide, please. And so I'm not going to throw a bunch of statistics at you. You all know that childhood hunger, food insecurity within our households, childhood obesity, anything related to nutrition and negative health outcomes is a real serious issue that we have to address in this country and New York State. And in academia, we're using this term wicked problem. Wicked problems are these problems that we try to tackle and tackle and tackle, and it doesn't feel like we're making a dent. Childhood obesity is certainly one of them. Poverty is certainly one of them. And what we're seeing is we really have to do an upheaval of our system, right, to address them. And some other concepts to be aware of is that, our bodies do a phenomenal job at trying to adjust to certain circumstances. Right now in COVID-19, I'm sure all of our bodies in a variety of ways and our kids we've been trying to adapt to the best of our ability. Interestingly, continues to be some really interesting studies coming out from the Dutch famine of the 1940s and how surprisingly the kids that were born during the Dutch famine ended up actually being at increased risk of being overweight or obese. And that's because their bodies were programmed to think that they were going to be born into a time period where they wouldn't have a lot of resources. And so we have to keep that in mind too, about the fact that our bodies are constantly adapting, our kids' bodies are constantly adapting to what's going on around them. And the other thing I want to emphasize, just because I have this great platform now, is we have to remind ourselves that our kids exist in so many settings, as we were just saying, and it's not entirely up to the parents. I've worked in childhood obesity prevention for many years now, and everyone says it's the parents, it's the parents, it's the parents. They want to blame the parents. And we all know that our parents are under an incredible amount of stress, right? And if a child is experiencing food insecurity right now during the COVID, the family is experiencing that. So we have to be very careful with that. In addition, we do want to keep in mind that, the health of parents impacts the child. With childhood obesity, again, we know that if parents go into the pregnancy, even before the pregnancy, and they're overweight, the child is more likely to be overweight, not just during childhood, but later on in life. And it becomes a generational issue. So we have to make sure that our parents stay healthy too in their families. And finally, it's not just about nutrition. Does it really start with providing an apple or produce to kids? I'll tell you that I worked in Chicago in childhood obesity prevention for a number of years, and we talked about bringing produce to families and in community-based organizations. And the leaders of our community-based organizations said, please, don't bring them. First, you have to help our kids and their teeth. They cannot chew these hard apples. So we have to remember to partner with all different healthcare, care providers, social service organizations, again, taking that holistic approach to wellness for our kids if we truly want them to be healthy. It's not just about giving the healthy foods, right? It's making sure they're healthy and they can consume it. Next slide, please. So I'll let you take a minute just to read through this a little bit. I know it's heavy stuff, especially towards the end of the summit. But epigenetics is an area that we have to watch. And I think we have so many wonderful advocacy organizations that are part of the summit today. And I think that this is a really strong point to make. Epigenetics is this wonderful field of study where we're learning that behaviors in our environment actually change the way our genes work. It doesn't change our DNA, but the environments, the nutrition we're providing to kids and their families actually can change their genes, the way the genes are expressing themselves. And the CDC has on their website as of this year that a pregnant woman's environment and behavior during pregnancy, such as whether she's eating healthy food, can actually change the baby's epigenetics, can change the expression of that child's genes, not just during, childhood, but later on in life. Again, taking the life course approach, and it can impact whether or not they have type 2 diabetes, in adulthood. And unfortunately, some of these changes can be inherited, we're finding out. So please keep in mind that. And next slide, please. So what's the solution? We've been talking about that all day today. Policy systems and environmental change strategies, which we will definitely be talking about during this panel. Not just the big P federal policies, but how can our organizations change their policies to support kids and their wellness? How can we change systems and ask ourselves, why do these situations exist? And I've heard a lot of that in our keynote today and in earlier sessions. Question the system, question why this is happening, rather than just continue to apply Band-Aids. And don't be afraid of making small environmental changes. I've worked on healthier vending initiatives, which was just about changing what's in a vending machine. And I'll tell you, it had major impacts on the kids that were visiting those machines. So let's keep an open mind to all of our solutions. Next slide, please. And I want to leave you with a question to ponder before turning it over to Misha here. How do we think upstream? In public health, we're starting to really talk about upstream rather than waiting to see the illnesses that our children are experiencing related to their nutrition and the type 2 diabetes we're seeing at a younger ages and things. How do we work upstream, not downstream, to address these things and prevent them from even happening? And certainly during the time of COVID and the impacts we're going to see, we have to be very serious about this as quickly as possible. Next slide. And finally, this is my contact information. It's such a pleasure to kick off this panel. And please feel free to reach out to me, and I'm happy to talk to you about the maternal and child health program offerings at the University of Albany School of Public Health too. Thank you.
Wonderful. Thank you so very much. That's wonderful information, and really appreciate that, Christine. And next we have Misha. Misha can continue the conversation and some of the things that they're working on with Hunger Solutions.
Thank you, Andy. And I want to just thank everyone involved with today's conference and here today, both for the essential work that you've all been doing long before the pandemic, during the pandemic, and then whenever it is that we emerge from this public health crisis. And we just hope that we can work together more in the very long road ahead. Before I jump into my portion, I should introduce us. Hunger Solutions New York is a statewide nonprofit anti-hunger organization. For the past over 35 years, we've focused squarely on USDA's federal nutrition assistance programs, including SNAP, school meals, summer meals, after school and childcare meals, and then most recently WIC, and then the pandemic EBT program. We work to maximize participation among all who are eligible, among all age groups. But our talk today is around children. And we know that these programs are invaluable for families and local economies, and they all remain undertapped in New York. And my job on this panel today is to walk us through each of these programs, kind of in a speed dating style, just to level set everyone on the reality of their reach in New York, and share updates and ways that you can help connect more families with them. So I'm going to start with WIC. Many of you may have had prior experience with WIC, but may not be familiar with its improvements in the past 2 years. And for those of you who are not familiar with WIC, the WIC program is administered by the State Department of Health and provides many benefits to pregnant women, new and breastfeeding moms, and children under the age of 5, including personalized healthy food packages, breastfeeding support, nutrition advice from registered dietitians, and referrals to other services. And to get WIC, the mom or the child must simply live in New York State and meet eligibility rules. And I just have to note that unlike with SNAP, a person's immigration status is not asked or considered as part of the WIC application process. And this has still been a great concern for some communities. And something that also might not be well known is that dads, grandparents, step-parents, foster parents, guardians, and caregivers can apply for WIC on behalf of the children in their care. There's been much research done over decades, Christine alluded to it, that show that WIC results in healthier pregnancies, birth outcomes, and is truly our nation's premier obesity prevention and nutrition education program. But that said, even before COVID, many eligible people were not participating, especially pregnant women and children ages 3 and 4. So to give you a sense of what WIC looks like in your area, I'm going to quickly go through some maps prepared by the State Department of Health WIC division that show how the coverage rate for WIC has changed in recent years. So as you look at the maps, counties in green have at least 50% participation. Counties in orange have less than 40%. Red have less than 30% participation, and some of those are much less. And so I just invite you to keep an eye on your county as we move through the next few slides. So 2015, 2016, 2017, 2018, and 2019. So you can see we have far to go to ensure that eligible families are connected with WIC. The vast majority of counties in our state had less than 40% participation among eligible New Yorkers in 2019. We don't have the 2020 county map yet, but the most recent statewide data reports that we have served about 360,000 women and children every month all through the pandemic. But that wasn't much of an increase from before. I mentioned some recent improvements. Some of you may know WIC from when food items were printed on a paper check and a family had to buy everything on their food list for the month all at once. The really good news is that since the summer of 2019, WIC benefits are provided on an eWIC debit card. This slide shows a photo of an eWIC card on the left and the main screen of the free New York State WIC to Go app on the right. And of course, this all makes the shopping process much, much easier and more convenient. Because of COVID, local WIC clinics are allowed to provide services remotely over the phone or video chat now, and they're loading the eWIC cards remotely as well. And so this is just a huge help for families and something that we are advocating to continue after the pandemic. And then last, thanks to the American Rescue Act, starting yesterday, actually, WIC moms and most children will get a boost in their monthly fruit and vegetable portion of their food package. This basically triples what they get now, and it will be $35 per month per person. So you can see how this could easily mean an extra $100 a month for young families to buy healthy fruits and vegetables over the summer. As you're able, we encourage you to use some outreach materials to help direct families to their local WIC clinics. In the wichelpny.org resource center, there are a variety of different outreach pieces and fact sheets, including some in Spanish. And even though you might not be the point person at your organization to help with WIC outreach, I would very much appreciate you connecting me with those who are. We might not think of it, but SNAP is actually our largest child nutrition program. In New York, it supports the health and nutrition of about 1 million children. We heard this morning a lot about the critical importance of SNAP during our keynote address and the Fed Talks. So I just thought it would really be most helpful now to let you know of a resource that we've prepared for you. I included this slide on SNAP's reach in the North Country as just an example. We've included we've created SNAP fact sheets on all congressional districts so that you can quickly get a sense of SNAP's reach in your area just by visiting our website. And then USDA and New York State recognize that many people may need some extra help completing the application for SNAP benefits. NOAP is a nationally recognized SNAP outreach and education program, and it's in place in most of our counties and all boroughs. Services are provided by local NOAP coordinators, some of which are in today's conference as participants. And NOAP coordinators are employed by community-based organizations. And we hope that you are already connected with your local NOAP coordinator, but just in case, I'm going to share just a little bit about their services. Here is a list of what NOAP coordinators can do. Their services are always free and confidential. They include pre-screening, helping applicants gather documents, fill out and submit the SNAP application, and they offer translation services if needed. NOAP coordinators work to make sure that applicants get the benefit that they are fully entitled to, not just the minimum benefit. And you can find your local NOAP at foodhelpny.org. Summer, it's June 2nd, summer is coming quickly. The Summer Food Service Program, or Summer Meals, is our nation's program that provides healthy meals and snacks to children ages 1 to 18 when school is out. These meals are traditionally served at locations where kids learn and play. And I'm sharing about summer meals because we have significant room for growth. When we compare the number of kids who ate free or reduced price lunch during the school year to those who ate summer meals in 2019, we are reaching only 1 in 4 low-income kids over the summer. Outside of New York City, that number drops even further to fewer than 1 in 6. And in many upstate counties, it's worse than that. We invite you to take a look at the report that we've prepared. We have it on our website and hope that this information helps inform local conversations and efforts to close these gaps in future summers. Of course, last year, many schools and summer meals sponsors served meals during school closures and through the summer. And many made good use of USDA waivers that allowed for grab-and-go meals and bulk distribution. And thankfully, those flexibilities are in place for the summer as well. If you would like to get involved with summer meals this year, there are several meaningful ways to do so, whether you're able to distribute grab-and-go prepared meals at your location, or if you would want to help with outreach for all of the summer meal sites operating in your area. On the website summermealsny.org, you can find sites and many resources you can share with families, including flyers and rack cards in English and Spanish, social media, texting alerts, web graphics, just like the ones on this slide, add to your website, newsletters, and social media channels. The next program I want to just very quickly touch on is the Child and Adult Care Food Program, or CACFP. This program also funds healthy meals for kids and teens, but in childcare and after-school programs. Like summer meals, there's a lot of room for growth in CACFP. Only about half of New York's children or New York's childcare providers participate in even fewer after-school programs. Only about 1 in 6 or 6 out of every 100 low-income students in New York have access to after-school meals. So I mentioned this program for 2 reasons. Some of you may offer after-school programs next year. And if you might be interested in adding after-school meals or snacks, please reach out and we can help get you started. And then the second reason is that if you might be able to reach childcare providers and after-school providers in your community. So I've linked our webpage where you can find resources to help spread the word about that. And then, of course, there are the school meal programs, which are vital support for families and mostly served free to all kids this year. And if you haven't heard the good news already, I want to share that schools will be able to serve free meals for all of next school year as well. Some of you are in schools and others may be connected with school administrators in your area. The schoolmealshubny.org has a lot of resources, including a school meals marketing toolkit that schools can use to encourage families to use their meal programs. And then the last program I'll mention is Pandemic EBT. This is a new program Congress authorized as a crisis response to COVID. It provides EBT food benefits to all kids who qualify for free reduced price school meals and who are also learning remotely. And the great news is that it's been extended and also expanded to serve younger children who participate in SNAP. Last year, over 2 million New York students received each $420 in pandemic EBT benefits to make up for those missed school meals when school was closed last spring. As a reminder, if they haven't used them already, and most have, families have a year from when they were issued to use them before they expire. And New York State, the state plan for issuing this school year's benefits were recently approved by USDA. So now New York can start moving forward with this year's pandemic EBT program. It is, again, a huge project. It will take some time to get those out. It's going to be staggered by region over the next few months, but I just wanted to share our PEBT website and give you a heads up that those benefits are coming, and we will be producing some resources to help families understand their benefits and how to use them. Part of today's conference is really a call to action to share stories and experiences and advocate for our nation's nutrition programs. And I just invite you to sign up for advocacy alerts and view our public policy priorities on all of these programs as part of your advocacy efforts. And I've gone over a lot of information in our short time together. I just ask that you consider connecting with the resources that can easily help you help your community and share even just a little bit of what you learned today with colleagues so that they can do the same. We just want children to have access to the entire suite of child nutrition programs that they're eligible for so that they can thrive. And I also want to highlight that our COVID-19 updates page keeps an ongoing update of just the various flexibilities and policy changes for each of these USDA programs as they become available. And then, of course, you can always connect directly. I've included a link to sign up for our email alerts, and we're very active on social media with posts that you can easily reshare on your channels. And before I turn it over to Tracy, and just thank you so much for taking your time to join us today, and really for everything that you are doing to support your community members. We really just hope that you consider us as partners in the good work that you're doing. So I'll turn it over to Tracy.
Excellent. Thank you so much, Misha. Wonderful information. A lot of great resources there. So thank you. And yes, Tracy from South End Children's Cafe. Maybe you could tell us a little bit about what you do and Impact with Wellness there. And just a quick reminder, sorry, before Tracy, I didn't mean to cut you off. If you have comments or questions, there is the link that you can click on and ask questions, and we'll get to those afterwards. So thank you, Tracy.
Great. Thank you so much. And thank you to the food pantries and also to SEFCU and to everybody that is participating and presenting. I've been on all day and have learned so much. So I really appreciate everybody for being a part of this. And I just also like to say thank you to the children that I have the privilege of working with every single day, because they're the real teachers for me, whether it's because they want to tell me they don't like broccoli or they love broccoli, whichever it is, they are definitely our teachers and the reason that I'm here with all of you today. So thank you to everybody. So the South End Children's Cafe opened in November of 2015. And for those of you old enough to know John Bon Jovi, he was somebody that sort of inspired us, because John Bon Jovi had opened a program in New Jersey called the Soul Kitchen. And the Soul Kitchen, excuse me one second. Sorry about that. The Soul Kitchen opened to have food served in a community setting so that people could come together and just share a meal. Just like if you want to get together with somebody, you may say, let's go out for a cup of coffee or let's go out for a bite to eat. And so the Soul Kitchen opened up so that people could come together, some who could pay and some who couldn't pay, but so people could just break bread together and talk about things and realize that we have more in common than we have that's different. And so we really followed the work of John Bon Jovi and the Soul Kitchen before we opened the South End Children's Cafe, because we really wanted to create a place where children and families could come and sit together and enjoy a healthy meal, which is very important, and just have a dinner together. And so in terms of the South End, healthy is really important to us. And I know that you've been in workshops all day, and we've touched upon the, the food security and food equality and food justice. So it was very, very important for us to be able to serve healthy food. We do have a chef that cooks every day for the children, and we focus on all healthy food that is not processed, is just cooked from scratch. And so that's something that's also been important to us since we opened our doors. When we opened, the mission was to impact food security, food justice, and food equality by offering a free healthy meal. But we also knew that we could hopefully impact overall wellness, which Christine talked a little bit about in the beginning. And so we actually have a program that the kids come to right after school, and they receive one-on-one homework help, and we play games. We're pretty old-fashioned, which is also why I couldn't get my PowerPoint up today. We are technology free at the South End Children's Cafe. And along with homework help, we just do old school playing. We play games, we jump rope, we exercise, we go outside. We're outside a lot. Even sometimes if it rains, we're outside in the rain. And just so that kids can be kids without staring at a screen or being plugged into something. So we participate for about 2 hours of just fun play with the kids before everybody sits down and has dinner. We have been doing this for 6 years now, and we have made a lot of memories and made a lot of mistakes and had a lot of successes. But we just continue to learn from all of you who are at the forefront of the food industry, of food equality, of healthy food. And so trying to learn from you so that we can bring it down to the level where we're just sitting down and having a simple meal with the children. Before COVID, we had served about 50,000 free healthy dinners. But when COVID hit, we went right into food mode and started serving food and delivering groceries and just really serving the community as in any way that we could. And so in the year of COVID alone, we doubled how many meals we served and how many groceries we delivered. And so we are now at about 130,000 meals served since we opened. And again, that doubled since COVID. But we just really focus on the healthy food. One of our first stories with the kids that I always remember is we make our spaghetti sauce from scratch. And one of the kids called me over and said, "Miss Tracy, there's a tomato in my spaghetti sauce." And they were really upset about this tomato. And it was actually a really great opportunity to talk about how spaghetti sauce is made, and that, where tomatoes come into the picture. And so while we don't necessarily do a lot of education in terms of talking about food and teaching about food, we use these teachable moments in order to share information with the kids about where food comes from, about growing food. We certainly have grown our own food. We're located right next to the Radix Center, which is an urban farm in Albany. So the kids are able to go and pick food, take food right out of the dirt and taste something, and also use the food that's grown at the Radix Center in the dinners that we cook as well. Aside from cooking for the children, we also serve meals to our families. Before COVID, families could come in and join the children for dinner. But since COVID, we send food home. We're hoping that in the summertime, when we can be outside, we'll be able to sit down again and share food outside with the children and the families. But right now we're sending our food home every day. We also cook for youth in the neighborhood that work for the Radix Center. So we're really grateful that we're able to do that. And we have 2 beautiful outdoor cupboards that we added during COVID. So we're able to, every night at dinner time, put dinners out in the cupboards as well. The cupboards have been really nice. They're right outside of the cafe, and people donate food and take food. So we have constant visitors to the cupboards, and it's just a really nice place for people to be able to give and to receive in a way that there's no questions asked. You just come on up, take some food, and you can leave. And it's been a really nice opportunity for our community, our folks, to be able to share food as well with each other and with the neighbors. Right now with COVID, we are able to we have had the kids back. We sort of closed and opened as a lot of you did, but we've had the kids back in full since March, and it's been wonderful to have the children back. In addition to that, we do a weekly grocery delivery program to any families that need groceries. Many of our food, most of our food comes from donations or from the regional food bank, or from food that we purchase with funds that we receive through donations. And so the groceries, the food cupboards outside, the dinners at night is basically what we do in terms of food. But we also try to teach the kids not only about where food comes from and hopefully a little bit about growing food, but we also think it's really important at the South End Children's Cafe to be about community. And often people ask me, what's my favorite part about the South End Children's Cafe? And it really is about the community. I think that we've been able to build over healthy food and that we're able to interact with on a daily basis. I remember a few years ago, somebody had donated 3 beautiful cherry tomato plants, and the plants were outside of the cafe, and the kids were watering the plants, and they were popping cherry tomatoes into their mouth and bringing them in for chef to use for our dinner, which always includes a salad from the CEFCU lettuce, if you were able to hear about the CEFCU hydroponic farm. And so that the cherry tomatoes were sort of fun for us. And one day I came outside and the tomato plants were gone. And I was really disappointed because somebody took our tomato plants, and the kids had been, nurturing them and learning about tomatoes from the plants. And one of the kids saw that I was really sad about it. And he said, "Don't worry, Miss Tracy, the person that took it probably needed it to feed their family." And I just thought that was sort of a message that, we're all trying to feed each other and to feed others. And it took a little child to bring a smile back on my face in terms of sharing food and building community around food and feeding each other. And I think that's what we try to do at the South End Children's Cafe, is to create community, to create children who are givers, and who recognize that there should be enough food for all of us to share, and there should be enough healthy food for all of us to access, which of course we're here talking about this, and we know that that's not something that is happening right now. And so in our little way at the South End Children's Cafe, we really hope that we're impacting food security, food equality, and food justice by offering these meals that we offer every day at the Children's Cafe. So thank you very much.
Wonderful, thank you. And honestly, I'm sorry that I didn't know more about South End Cafe. That was wonderful to hear what you've been doing, and just a great presentation of connecting with the community and food insecurity and child wellness around nutrition. That's wonderful. I did want to open up to see if folks had questions for our presenters. So if you do, please pop them in the comment box. I actually see one here. And one of the comments, will you be able to connect with programs like the Night Market and Soulfire Farms as well as the Raddick Center? And it looks like that may be for Tracy.
The South End Children's Cafe is located at 25 Warren Street in Albany. Just so you all know, there's 3 Warren Streets in Albany. So if you come to the South End Children's Cafe, make sure you put 12202 in the zip code. The Raddick Center is right next door to us, and it's open just about every day. If you go there and the gates are open, you can go on in. You can go in and hold a chicken and see where their eggs are and help gather some eggs. You can bring your own kids. If you're teachers, you can bring your students. They have a really beautiful greenhouse, and they will talk to you about how everything just feeds everything inside the Raddick Center. It's really, really an incredible place. Soulfire Farm, I don't want to speak for them, but they're just an amazing program, and they have a whole bunch of educational programs on their farm, and so that's a great place to connect to. And the Night Market is held every Thursday night on Warren Street in front of the South End Children's Cafe. And I can share after this the information, but you would contact A Village, which runs the Night Market, and they're always looking for vendors, and they're always looking for shoppers. And so there's delicious food, and there's produce at the Night Market, as well as a number of wonderful artisans that share their information and their wares at the Night Market.
Wonderful, thank you. So again, if you have comments or questions, please put them in the chat box there under comments, and we'll be able to get to them. Maybe just in the few minutes we have left, and this is a wonderful presentation and so informational, so thank you. The earlier conversation around food is medicine, and food being talked as a social determinant of health. How do we message that, I think, and how do we get youth and children access to that same message and understand that? And is that message out there enough? I'll just kind of put that out to the group.
I would just like to start by saying that I made the joke about broccoli, but our kids really do eat the broccoli. And so if we have, and this is, everybody knows this, but if you offer something to somebody, especially a child, they will try it. Maybe they won't like it, but maybe they will like it. But it's getting over that hump of being able to have the food, access the food, to give to folks so that they can try the food. So the accessibility is really important in terms of bringing the food that everybody deserves to the table for everyone equally.
Yeah, and along with that, I know from all the research I've seen, from the pediatricians I've talked with and other, nutrition experts, they've said, don't give up on kids, right? Keep introducing it to them. And they may say no for 10 years, but maybe on that 11th year, they'll like, I'll try that. I know that that's the case with my son. Or strangely enough, there are things he would eat in preschool because he had fantastic preschool teachers that introduced him to foods, and then now he won't try it. And he said, no, I used to eat that in preschool, but not now. So, kids will change their mentality about things, and their taste buds obviously are still developing and things like that. And as adults, we're still trying things. I know I didn't start eating avocados till my 30s for some reason, and now I feel like I was missing out for 3 decades of my life. But yeah, it's a really interesting concept. I think, developmentally, kids are able to understand things at different stages, right, of their development. So we have to think about how we market that and to them, that message to them, and in a developmentally appropriate way and at different stages throughout their childhood. And obviously, with high school students and everything, we can talk about this in a mature way. I know with my son who's going into middle school, he can start to grapple with that a little bit, but starting with the younger kids and the preschool age kids, they're smarter. And I've learned this from my research with youth too, and children too. They're smarter than we give them credit for, and they can actually think about some pretty big concepts as long as we put it in a very developmentally appropriate way. So Andy, I do think that we have to start thinking about how we're messaging and thinking about that concept and messaging it to kids. One thing I just want to say is, kids are sometimes the best teachers in the families. And there have been some really interesting studies and interventions done with kids where parents weren't, wearing seatbelts. And in one particular study, I wish I had the author's name on the top of my head. So what they did is they actually taught the kids how to work, the seatbelt at a very young age. And then they had them go home, and they were the ones that every time they were in the car, they were the backseat driver saying, you're not wearing your seatbelt. So I think that if we think about packaging that message to kids, they will take it into their families too. And we should be doing more work in this area.
Thank you. That's wonderful. Misha, do you have any thoughts on that? Or
I completely agree with everything Christine said. It's not my yet, but as a parent and as I just remember, and the constant, it's in our DNA to refuse things at first unless it's sweet, and but it's just a pleasant, consistent introduction of all, eat the rainbow situation, and again, with kids, they're developmentally appropriate, this will make you run speedy quick, I remember was something that really worked with my kids, and, make you feel better. And then as you're older, they get to understand more of the health benefits, but just meeting the kids where they're at, and be pleasantly and consistent, to, we'll try it, and have it available to them. So some of the benefits, I think, from a parent's perspective is that some of our nutrition programs allow for that consistent introduction, and are opening up the capacity and opening up new foods to kids as well.
Good. Excellent. We had 2 other questions in there, so I'll ask these, and we have to be kind of respectful of time with I think we have a 3:50 deadline here. So first question is, for programs like WIC and SNAP, can community organizations in areas where there's low enrollment be a conduit for ongoing promotion and enrollment?
Yes. Absolutely, yes. So I'm not sure. I see who that's from. I'm not sure specifically how you would define being a conduit, but there absolutely is a need for consistent messaging. You might be in a program in our community-based organization that's what we consider a trusted messenger. People in outreach and information know that people need to see and hear and read things multiple times from multiple people, who that they trust. And if you are in an organization where you have relationships and trusting relationships, it's going to mean a lot to encourage people to access the programs that they're entitled to.
Yeah, I must honestly say that when I saw the maps, thank you for sharing the maps, that light bulbs went off in my head that we need to look at how we do in our own county to connect people to resources and make sure they're aware. And how can Captain, as an organization, be also helpful in that process? And just maybe our last question here, depending on how we have come in, but I think it's a great question. How do we engage more children, youth in changing norms as it relates to wellness and nutrition? Schools are not always the best. Are able to serve this area because of their requirements. There's some thoughts there.
Well, I always say that the South End Children's Cafe is an easy model to replicate. And if anybody wanted to try to open another South End Children's Cafe, we would love to tell you how. I think that's really important to have more access and more programs where children can come and sit and eat, but also eat with other folks, their parents, their peers, so that there's role modeling going on and everybody's equally, getting the same food and the same opportunities and the same access. That not only encourages children to eat, but it also takes the shame away from that inequality that there is around food. So I think that the more we offer for kids outside of school time, during non-school hours that has to do with healthy food, the more opportunities they'll have to eat healthy foods.
Yeah, and if I can add to that too, I think we have to get extremely serious about engaging youth in a meaningful way, have them as part of our advisory committees, consult with them. Like I said, with my dissertation research, the whole reason I started my dissertation research was because I didn't see youth representation on school wellness committees. And I just knew that they were thinking about wellness. I just had a feeling they were thinking about wellness in a different way than adults were talking about it. And so there's a lot of great, literature out there and models out there for how you can meaningfully engage children and youth in discussions around things such as nutrition. And just how they want their settings, their community-based organizations, their schools and everything to promote their well-being. So I hope that we all can think about that for our own organizations, about how we do engage them in decision-making and policy making and important decisions like that.
And I would only add that I do think that schools are able to be a conduit for this. We know that the school meals, thanks to the last time the child nutrition programs were reauthorized in 2010 with the Hunger Free Act. I forget the whole name for the act, but significantly changed the meal requirements in school environments, and it takes time, as we talked about, with kids being getting used to healthier foods. I remember my kids at the time were like in second grade and they came home and they're like, the menu changed. And instead of, instead of saying cucumber slices, it said cucumber coins, or it was, whole wheat pizza, but it was, they said it in a really fun, cute way that made it, it was healthier, and the language around it was fun for the kids to have them accept and try things that maybe they weren't excited about before. I do think schools have a lot of credit for helping to change our culture around food.
Wonderful. Well, with that, I think we do have to bring our panel and workshop to a close as we get to the closing remarks for this summit. I just want to, thank you very much to Christine, Tracy, and Misha. Thank you for this wonderful presentation, bringing this information to the the summit, and also to everybody that was able to join us this afternoon. And a big thanks to Food Pantries, the Capital District, for hosting this, and thank you for everybody who attended. So any just quick parting thoughts or anything from the panelists?
Well, we should thank you too, Andy, as well, for serving as our moderator. So thank you. And thank you to all the participants. And it's been an honor to serve on this panel with my other panelists.
Yes, thank you, everybody. Thank you all for the hard work that you do and the great work that you do.
Absolutely. Thank you to everybody.
Thank you. Well, have a good afternoon, everyone, and thank you again.